What is going on, everybody? It is Mark Cargila, lead faculty and founder here at Modern Pain Care, coming at you for another episode of the Modern Pain Podcast. And this week, Jared, as you'll find out, and you probably already know, he teaches kind of adjunct faculty at a DPT program over there in Texas, which is a gold mine for podcast topics because it's always good to kind of get yourself back in that role of a DPT student, maybe early career professional, and hear kind of what's kind of going through your guys' heads as far as things you're thinking, concerned about, questions you have. Because sometimes, being a 20-year dinosaur of the profession myself, I sometimes lose sight of what it is to be a DPT student. Some of the stuff you guys go through when you're making that part of your journey and getting through it. But before we get into this week's topic, let's just see how Jared Hall's doing. How you doing, Jared?
I'm doing good, man. As you mentioned, I'm kind of in the thick of the MSK curriculum right now, and as a matter of fact, this Friday I get to go in and grade a bunch of final practicals. The way that we do the curriculum is kind of spine focused in one MSK course, and then in the second MSK course, it's more extremity focused. So we've been going through the lumbar spine and the pelvis primarily this semester, and that's kind of to set them up because they go out on clinical internship in a couple of weeks, one of their first clinical internships. So we determined, hey, there's a lot of low back pain, and that's the number one thing people are seeing. Clinical instructors are pretty upset if you send a student out that hasn't had any exposure to the spine yet. So we kind of developed our first MSK coursework to really focus on the lumbar spine. So there's been a lot of fun, interesting discussions that have come up, of course, when you're going through a lumbopelvic course curriculum, and that led to the topic today. The other day in class, we were doing exercise case studies, and that's kind of what we do. We teach examination, and then we teach special tests, and then we bring it in and go over clinical case studies and kind of bring in exercise and what would that look like over the course of a rehab plan of care, right? It's kind of how we finish things up. So we're doing these exercise case studies, and this person has low back pain in the case, of course. And once they got them better, they kind of laid out their plan, and then they brought up the idea of, well, then we would teach them spinal hygiene to make sure that they don't have low back pain moving forward. So this was one of those cases where the needle like pulled off of the record. It was like, and I was like, whoa, 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 whoa. Let's talk about this. What is spinal hygiene? And I just posed that question to the class, like, what is spinal hygiene? And everything gets quiet, and everybody's kind of looking around at each other because they're like, oh shit, we did something where Dr. Hall's about to come in at us and ask us a bunch of questions, because this typically happens. I asked a bunch of reflective questions and that sort of thing, and somebody finally says, uh, like, you teach people good spinal hygiene so they like maintain a good posture and that they don't get themselves in bad postures that cause low back pain. And then somebody else said, like making sure that you keep your core strong. Like spinal hygiene would be keeping your core strong, your transverse abdominis and your multifidus and stuff like that, to make sure that you don't develop low back pain. And then somebody else said, it's like making sure that you don't have too much lumbar lordosis, or a lack of lumbar lordosis in your pelvic posture. And then somebody else said, like making sure that you keep your hips really, really strong, so the lower part of your core is stable. You keep your pelvis stable. So these are all the things that came out. And I think this didn't come up, but this has been something that I've heard before in relationship to spinal hygiene, is like making sure you sleep in good positions so you don't have your back in a bad twisted or bent position all night. And lifting mechanics came up. So teaching people good lifting mechanics so they have good spinal hygiene when they go throughout their day. So with that topic coming up and that little bit of discussion, the feedback that the students gave me, what does that make you think, Mark? Where does that take your mind?
I think I get worried because we were talking before the podcast. I can't remember where I came across it, but somebody shared like a picture of a spinal decay report that they received from a healthcare professional, which we won't name what the professional was, of which again goes to this like hygiene thing where you. I think in the general sense of taking good care of your body, I think I can get on board with, I guess, that kind of thing of hygiene, like dental hygiene. You need to brush your teeth and, make sure you're flossing, which, floss. I'm still working on getting on a consistent bandwagon with that. But anyway, I just think being careful of how much this becomes like just good, healthy human habits of, I tend to strip it back maybe a little bit and not get so in the weeds of some of the things that traditionally, again, posture being some this blanket statement that we throw on everybody. I think in an n=1 scenario, posture may matter. It may matter if I can have change somebody's posture and it changes their symptoms for the better. Then I might think posture in that situation is helpful. I've always referred to my issues with posture when I had acute discogenic pain. It definitely influenced my pain, and so I just think. But that's where you are as a DPT student. You kind of know these things from just kind of general PowerPoint statements that you read in textbooks or online Instagram influencers and other folks who make these blanket statements that lack the nuance that the clinic holds. I know you mentioned that they're about to embark on the clinic. I just remember that too. I mean, that's like probably one of the more freaked out parts of my life, because you never feel like you know what you need to know. You feel like you're going to fail and you're going to go into this clinic and not know anything, which you guys know a lot more than you think you know. But yeah, to get back to the hygiene thing though, I part of me wants to cringe when I hear the word. I don't know why. It's just, I think sometimes it can be, and maybe it's because this overprescribed posture and lifting mechanics and things that we know the research has really called into question as far as making these blanket statements of that there's one way to kind of approach these topics. I think there's a lot more nuance to it, but I think that's again where the mindset is. I know that was where my mindset was. Is I was much more safe to make blanket statements. I felt much more comfortable in the shoes of a DPT student, because just trying to survive and drink through the fire hose that is grad school and DPT training. It's hard to really carve out that nuance at that point of your training, just because you're in survival mode of like, God, I got all this stuff on my plate. So sometimes it's easier to kind of simplify things, but I don't know. What do you think about that simplification and how it can maybe negatively impact both patient interactions and maybe that person's growth as a clinician? What do you think?
Yeah, I mean, I definitely think that it's an oversimplification. It's something that somebody came up with along the way, because, and of course, like very well intentioned, right? Somebody made the analogy to say, well, you work on brushing your teeth every day, like you care about your teeth. Well, you need to work on spinal hygiene, so you need to do things every day that'll keep your back healthy. The problem, I guess, is it kind of worries me because you think about dental hygiene and you legitimately like get cavities and stuff like that if you're eating shit food all the time and you're never brushing your teeth, and that's like a real thing that we have a lot of solid evidence occurs. What we don't really have is a lot of solid evidence that if you don't bend your back certain ways, you're going to develop back pain. And that if you don't keep your transverse abdominis firing at the appropriate firing rate, you're going to get back pain. And if you don't have a certain amount of multifidus bulk, you're going to get back pain. Well, what we do have is a whole bunch of research that says that that's not necessarily really well established or even a real thing, right? All of our core exercise research is just about as the same as any other exercise approach research on if it helps back pain. And we don't have crap to say that if you regularly work on your core or your transverse abdominis that you will prevent back pain. We definitely don't have anything. We definitely have research to show that lumbar lordosis or static lumbar posture has no bearing on whether or not a person will have low back pain or develop a lumbar injury or anything like that. So like I get the thought process behind it, and it was probably a little bit of like a sell to people to say, hey, you work on your teeth every day. Like, let's do some stuff to make sure your back stays, moving and flexible and that sort of thing. And I think for a person who is probably really sedentary and maybe doesn't get much physical movement or activity in their back, and they just have these prolonged sustained postures, we'll say sitting, right? Or people are sitting at work 8 hours a day, and then they're sitting in the evening on the couch 4 hours a day. Maybe they lose flexibility and have tissues, muscles that aren't as strong as they could be. Like, I totally get the thought process on, hey, let's move this a little bit more. Let's have some variability of movement in your life. Like, your joints were made to move different directions. Let's kind of explore those different directions, and just keep you in a constant state of appropriate motion. But to kind of layer the hygiene thing on it, I think it automatically sends a message of good and bad, right? It sends a message of, hey, this is good posture, this is bad posture. Hey, this is good movement, this is bad movement. Hey, this is good lifting technique, this is bad lifting technique. Hey, if your core is not strong, that is bad. And if your core is super strong and you're working on planks all the time, well, that is good. And it's almost a bit of a scare tactic too. The more I think about it, it's like, if you don't do this, if you don't do these things, well, then your back is just going to fall apart. Like, you're not working on this stuff. Guess what? When you go in to get your x-rays, your shit's just going to be like crunchy, right? You're going to have degenerated this, that, and the other. So it's actually it could be a little bit of a slippery slope, right? I don't want to make the slippery slope fallacy argument, but there's a lot of things in that whole concept of spinal hygiene that really need to be unpacked and thought about.
Yeah, I think it's the typical false dichotomies that get created of like good versus bad. And again, that's where the nuance of clinical reasoning and being able to determine in that situation, do you have a reasoning process and a way to test, treat, retest, different things that can make you have some decision making that can make, okay, maybe in this situation, getting some strength around the trunk and getting them more robust to take on loads in the trunk might be a very helpful thing for that person. Or maybe, again, like the posture example I said, but I do think there's a little bit of possibly a marketing spin that gets thrown on this, and maybe that's maybe partly of where this stuff comes from. Is like, if you can sell somebody on the thoughts of spinal hygiene and that you can provide it, and like, hey, you take care of your teeth, why don't you take care of your back? Guess who can take care of your back? This guy. So come and book a 8-visit package with me, and we'll get you on a spinal hygiene program. So I could see like the marketing aspects of it. Yeah. I mean, again, I don't think the general, thought process of just taking good care of your back and body as a whole is bad. I tend to simplify it to more lifestyle, like sleep good, eat good, maintain good social relationships, move variably throughout the day, and I think we're in a good shape if we do those things in a vast majority of, human situations. But I mean, obviously there's nuance to different people with genetics and, past history. There's just so many things that go on within a person that can make them. And I like to just refer back to Matt Lowe's vector model. In certain cases, maybe some of those components of spinal hygiene added together might have a summative effect to where it builds more buffer or robustness to where maybe an episode of back pain becomes less likely. Again, that's all speculative. We don't have a painometer that can really measure that objectively, but maybe we have studies where and I'm not aware of them, if like we really enroll somebody in such a program where there's this conscious effort of these spinal hygiene concepts being employed, and do we see injury risks and prevalence of injuries decrease as a result? There might be some things. I know there's some probably some occupational data on workplace injuries and stuff, maybe with some of these programs. I'm not aware that there's any good, it's been a while since I've dug in that literature of like any of these lifting programs and different things that it's really been significantly able to demonstrate decreased injury rates and things like that. I just think it's an attempt. I think a good thought in general, as far as like take good care of your body, I can get on board with that. But like if we strip it down and then we start ascribing these narrowly focused rules of posture and core, and we've seen what it can do to people when they get locked in this movement jail situation of like, oh my God, and some people might take that information and really restrict life because of it, and some people might just take it on board. Hey, yeah, fine, I'll just be a little bit more mindful of some good movement throughout the day, and maybe I'll just do some stretching throughout the day and build some strength around here. But they're not really taking it so to the nth degree, to where again it becomes a limiter versus a helper in what they're looking to do and accomplish in life. But again, I think it goes back to just the mindset of where you're at in those situations. It's easier to take on these kind of black and white, dichotomous ways of looking at pain, which obviously, hopefully, if you've listened to this podcast, we've tried to unpack a bit of the complexity of what we're dealing with when we're dealing with humans in pain. So I think we just have to be careful when we start tossing these type of terms around, so we're not, unintentionally creating some issues with people who take these concepts and run with them to a point it again starts limiting their pursuit of things that are important in their life. So yeah, I think it's obviously I know there's been discussions of spinal hygiene and other places as well. We won't get into some of the social media stuff just because I don't feel like getting any emails or anything like that. But what do you think as far as like a DPT student? What's a good way to kind of think about maybe this concept when they're rolling into the clinic? Maybe it's your group that's just about to embark on their first clinical rotation, and they're starting to think about this concept and try to think about it with a patient in front of them. How would you recommend they go about thinking about spinal hygiene or good spinal care? You've already laid out the lack of evidence we have for a lot of this stuff, but again, maybe there might be a time and place for just taking good care of yourself. What do you think?
Yeah, I mean, if you think about what is spinal hygiene, I think you, you have to think about what do we know, like what do we have decent data on that says increases a person's risk of developing low back pain. All right, and what we know fairly well is that psychosocial issues like lower education status, anxiety and depression, dissatisfaction at work are predictors of a greater risk of developing low back pain. We know that maintaining a position, any position, any posture, whether it's prolonged standing or prolonged sitting, for greater than 6+ hours a day tends to be a possible risk factor for the development of back pain. I think being a smoker is an elevated risk of low back pain, and I think maybe even subsequent spinal fusion. I believe there's a study that shows that, but I also know failure rates with fusion if you're a smoker as well. Being overweight, right? Having a BMI that is pretty far above normal ranges, getting into the 30 plus range, 35 plus range is indicative of a future risk of low back pain. So, and we know in general, poor sleep patterns, right? Being chronically sleep deprived is a risk factor both for making existing pain worse and lowering the threshold for pain pressure threshold in experimental testing, which would be indicative of probably an increased likelihood of developing any sort of pain condition anywhere, right? So when I think about spinal hygiene, I'm thinking, well, we probably need to keep people moving, right? Don't be sedentary. Don't maintain any position. I think about the spine just like I think about any other joint. Like my elbow, I want to probably spend most days where I get my elbow fully extended and fully bent in some ways, right? I want to get my knee fully extended and fully bent in some ways, because if you don't take a joint through a full range of motion, there is a likelihood that it becomes stiffer and or you develop contractures or whatever it is. And even if that doesn't lead to an injury immediately, it may lead to a restriction in valued activities that then maybe puts stress on different parts of the bodies when you go back to do a valued activity that maybe you don't do as frequently as you used to, something like that. I think about we need to educate people on healthy approaches to sleep. We need to talk about the importance of mental health, and be willing to talk about that. Kinesiophobia, fear avoidance, anxiety, depression. Maybe get people in contact with other healthcare providers that could help them with that, whether it's through pharmaceutical management or more cognitive behavioral management. Same thing with nutrition and body weight. These type of things are predictors for back pain. So if you think about what is spinal hygiene is keeping your body and mind in general as healthy as you can through regular movement and exercise, good sleep, adequate and appropriate nutrition, having good social relationships, and mental health from that standpoint. That's the same stuff we would say for any injury. That's the same stuff that we would say for just about any sickness, right? We would say the same thing for cancer. We would say the same thing for heart disease. We would say the same thing for various other, ailments that afflict the body. Low back pain is not really any different. It's just a different manifestation of, various underlying factors that aren't as clear cut as just how well does a single muscle function.
Yeah, I always think it's interesting when as you were speaking about that, is like, and I think Gifford's model of the vulnerable human model, there's the mature organism model, and then, where, again, all this kind of vector model based stuff, the kind of this lifestyle based things that you mentioned, and a lot of these kind of more bigger picture human health, healthy human lifestyle type things, those things start stacking up. And then there's our risk factors or chances of developing some of these things. And that's just where you got to get to know the person in front of you and where they're at in those things, and be willing to have some of those challenging conversations around mental health, stress management, those type of things. We'll probably talk next episode about a little bit of the person-centered care way of looking at that type of stuff, as far as being able to really understand the unique person in front of you and tailor yourself to them, and not just where you're fitting everybody to you. Just because I think you can connect and help a lot more people. But yeah, no, I think that's a good way to look at it, as far as, these thoughts of hygiene. I think just general human hygiene of being a healthy human is all those type of lifestyle things that you mentioned, and seeing how that can be interwoven through not just low back pain, but sickness. It's interesting, especially working with a lot of persistent pain people, where these chronic overlapping pain conditions, which I know you've talked about a lot in the past, and even in some of our programs, as far as like seeing how these things stack up and can really dysregulate the human ecosystem to where it emerges with musculoskeletal issues, GI issues, headache, migraine, TMJ. All these different things that we're starting to see. And I think maybe hygiene needs to be a little bit more of a big picture thing of just overall bigger, good human health lifestyle thing that can really impact in multiple dimensions of what we think human health is, more than just an MSK way of looking at it. So, yeah. What do you want to leave folks with today as we kind of wrap things up, Jared?
Man, I guess in a nutshell, we probably need to reduce the scare tactic spinal hygiene and start focusing more on the whole human hygiene, or lifestyle factors, and how that can influence not just back pain, but a multitude of different ailments that can affect the body. So we got to zoom out a little bit. We got to start looking at the whole person a little bit more so, and stop hinging on really hyper specific micro factors that probably aren't as relevant, and then stop scaring people with those, and stop thinking about the spine as different than any other part of the body, and susceptible to degeneration and degradation and all this sort of stuff. Like, you're not going to have plaque build up on your back. It's different. So yeah, I would like to ask people to start having a discussion on it and reflecting on looking at spinal hygiene different, or maybe even throwing away the term altogether.
Yeah, no, it sounds like a reasonable thought process, and I'd love to hear where you guys are at with it. As far as we'll be throwing these episodes up on Instagram and our Facebook page. Would love to hear your comments on where you're at with the whole spinal hygiene discussion, and where you fall on it. And did we miss anything? Is there anything you think we overlooked, or do you have any disagreements? We'd love to have some discussions. Obviously, let's keep it civil, but yeah, we'd love to hear where you're at on the spinal hygiene debate. So check us out on there, and if you don't mind, subscribe to the podcast on iTunes, Spotify. We're on all these, Google Podcasts, all the different platforms. And if you're even feeling really generous, leave a review, because that also helps us get more exposure to help this information get in the hands of more folks that might benefit from it. So we're going to leave it at that this week. Hopefully you guys found some value in this week's episode, and we will talk to you next week.